Hi everyone, welcome back to our lecture on physiotherapy in gerontology. This is the updated the continuations of our earlier lesson 2, theories of aging and models of service delivery. But for this lesson 2, it is actually the part 2. We'll be looking at or focusing on models of service delivery. Okay, so you must remember that the earlier one of the learning outcomes is to identify the disability models for geriatric rehabilitation. So we will continue with this. Okay, so uh okay, so this is the sections for the model of service delivery. Okay, so I'm sure that the majority of us here, we already learned maybe more than framework or model that explain or guide us to the rehabilitations of older people. Okay, but not only limited to older people. Actually, there are many models that guide physiotherapists on their assessment and interventions for their clients. Okay, models are not only restricted to older people, but is also applicable in many areas of physiotherapy. Okay, especially for musculoskeletal and neurological conditions. Okay, so we know that assessing or dealing with clients is actually very challenging. Okay, with patients presenting to us with a very mixed presentation, so sign and symptoms, behavior. Okay, so for people, or when you are learning gerontology or geriatric rehabilitations, okay, it is unique in terms of you have to know all the physiological system of the body. Okay, for example, the musculoskeletal, neurological and cardiovascular system, you have to know all this. All right, similarly for pediatric cases also, you have to know all the physiological system. All right, so interlinking between medical, psychological, rehabilitative, economic and social problems that all need attention is the norm rather than the exception. Okay, so again, unlike other area of physiotherapy, okay, for clients or elderly clients or older people, right? So you should you should okay, combine all the aspect of domains of, like, biopsychosocial models. All right, so you must understand the biopsychosocial model. All right, there is some element of course, for physiotherapists the major element is on the biological domains, but or medical or physiology. All right, but for older people we also need to understand the psychological aspect as well as the sociological aspect. Okay, so older people normally they have different presentations in their disease. Okay, so these are considered unique pattern of aging. Unique here means that they are different from the young people. Okay, and sometimes the disease that is found in young people can be found in older people, but most of the diseases that suffered by elderly, okay, older people, may not be found in the young people. Okay, so this is what we call as unique, right? So it is complex. All right, so we use maybe a model to represent the possibility of the patient. All right, so that the model or the use of the model is understood by everybody, so everybody have the same understanding of what the patient is presenting. Alright. So we know that older people, alright, so where do where you can find them, okay, in various settings, alright. So of course the ill one, they're normally found in the hospital. So hospital is a short term, long term care, a short term care, alright. So they stay for a while in the hospitals, okay. So once they recovered, or they show symptoms of recovery, or maybe sometimes they don't recover at all, but nothing can be done, so they are discharged from the hospital. Okay, so discharged from the hospital can be they can be discharged into various places, all right. For example, they go back home, all right. They can go back home if they have a caregiver who are willing to bring them home and to take care of them, or they are discharged to a long-term care, all right. For example, like nursing homes or any institutions that can take care or their provide services for older people. All right. So you find elderly in the community as well. All right. So in the community, meaning that they are living independently in the community where they manage themselves. All right. But you must remember that even older people who probably lives in the community, uh, sometimes they are also ill, but it's just that the family can look after them. All right. Okay. Where else do you can find elderly? Right. Uh, so now the fundamental principles on which physiotherapy with older people is based are: disability is generally regarded as being due to a pathological process or injury, not a prima facie old age. Okay, so disability is, it's not, when sometimes when you get old, you don't really get disability, but it is related to pathological changes. The effects of biological aging, okay, so this could be a normal aging changes, reduce the efficiency of the body system, but throughout life, optimal function is maintained in each individual by continuing to use the system to their maximum capacity. Okay, so continuation of activity, right. So physiotherapists have a key role in enabling older people to use a number of the body system fully to enhance mobility and independence. So our goals for older people, especially those very advanced age, okay, is to enhance their mobility and independence. So when neither improvement nor even maintenance of functional mobility is a reasonable goal, the physiotherapist can contribute to helping older people to remain comfortable and pain-free. So prevention of the development of problems in later life through health promotion. Alright, so how? Okay, how to empower older people? How are we going to promote healthy aging? Okay, aging gracefully. Graceful aging. So as I mentioned earlier, there are many models that can guide our assessment and treatment. However, okay, the most established one used by physiotherapists, occupational therapists, and many other healthcare providers, alright, is the ICF. Okay, so so the ICF, okay, offers a model to enable healthcare professionals to review multiple impairments and relate them to the ICF domains. Okay, so we will look at what are the domains later to guide assessment, goal setting, and treatment planning. So impairments often impact on activities of daily living, remember, and how the person can participate in societal roles in later life. The ICF framework also considers issues in context, for example, environmental and personal factors. Okay, so remember that each individual may have different environment and they have their own personal factors. These can act either as barriers or facilitators in the analysis and the subsequent planning of appropriate interventions and support. As a point of interest, many hospitals in the UK now use the related ICF, okay, to code, okay, so they are already beginning to use, they already started using code for patients' problems on admission, because using the code, everybody who are trained to use the ICF, okay, they understand what is the problem of the patients, okay, so this will guide them on the further assessment or goal setting and treatment planning. Alright, so this is the typical domains of the ICF model. Alright, so it consists of, okay, so please look at this carefully. Alright. Okay, so let's look at each of the components. Alright, okay. So, the first one, remember the health conditions, okay, is the umbrella term for diseases, any disorders, injuries, or traumas. Okay, and the next one is body function and body structure. You can further break it into body function, okay. So, it refers to physiological functions of the body system, while structure refers to the anatomic parts of the body. Okay, then impairment, okay, so this can be referred as impairment to the body function and body structure. Alright, so these are the key terms that you found in the ICF model. Right, so impairment, okay, any impairment to the body structure or body function, okay, such as deviation, any deviation or loss in the functions or deviations of the structure, it is considered as impairments. Alright, next is activities. Alright, is the execution of tasks or actions by an individual. Okay, so when a limitation of the activities, okay, it refers to difficulties in executing activities, for example, like inability to perform ADL. Alright, okay, so participation is refers to the involvement in a life situation, okay, and participation or restrictions to the involvement in a life situation refers to any problems that limit or restrict this involvement in a life situation. Okay, for example, what, going to the society, mixing around with the society, working, just going out from the house. Okay, and it also manifests the level of quality of life of a person. Okay, then the environmental factors, any physical, social, and attitudinal environment in which people live and conduct their lives. And lastly, the personal factors is the particular background of an individual's life and living, comprising features of individual that are not part of a health condition. Okay. Alright, so these are the some of the coding, but I don't have the code. Okay, if you want to assess function, okay, you look at mental functions. Okay, this is very relevant for older people. Every time we assess older people, we need to assess their mental function, because we need to ensure that they understand. Okay, they can understand whatever we ask them to do. We tell them, we educate them. Alright, and mental decline is quite prevalent among older people, partly due to aging process, and of course partly due to any pathological changes. Okay, sensory functions, speech, functions of the cardiovascular, hematological, immune system, respiratory system. Okay, so you name it. Alright, and then look at the structure of the nervous system, which you normally are not able to see with your naked eyes. Okay, okay, and activities and participations. So So learning and applying knowledge, general tasks and demands, communication, mobility, self-care, domestic life, interpersonal interaction and relationship. Okay, so these are the important domains and subdomains that is actually important for uh, living a good quality of life. Okay, and then you have the environmental factors. Okay, so this is an example of a condition, okay, which is common among elderly. You know, when they fall, after a fall, they may sustain distal radius fracture, okay. Of course, we know that the most common injury sustained after a fall is fracture of the hip, hip fracture, be it in the neck of femur, the trochanteric region. Okay, that's the most common fractures that normally they sustain after a fall. Okay, so what happened? All right, what is the impact to the body function, activities and participation? All right, so they may have impairment in of course deficits in anatomical structures or physiology. Example, they complain of pain, weakness, loss of dexterity, and this will tell us what outcome measure um, to measure, okay, any decline or improvement in their in the impairment. Okay, so because of this impairment, it leads to activity limitation. They're not able to do tasks such as opening a jar, turning a handle, assemble parts. Okay, and activity limitation lead to restrictions of participation. They are not able to engage in roles and activities like cleaning, gardening, grandparenting. Okay, so if a person loses the muscle power in his legs, what happen? They may not be able to walk properly. Okay, so walking properly is activity. Losing muscle power is functional impairment. Okay, so this may make it impossible for him to do his job. Okay, and this is the participation restrictions. Okay, so the ICF model is used to map. You can use the ICF model to map the problems with the patients. Okay, so you can use coding. Okay, alright. So this is another example of how the ICF model is used to map the challenges of the patients and how you relate this to your intervention. Okay, so when you share this mapping to anybody within the healthcare provision services, okay, they understand what is it about. So this is another examples of how you use the ICF model to record the data from your assessment of a patient, and if you share this with anybody among the healthcare providers, okay, they can understand and they know what to do with the patient. They also have their own, they may also suggest the intervention. Okay, so this is a very 2011, published in 2011, brief ICF course set for patient in geriatric post acute rehab facilities. Okay, so they also have the ICF course set, okay, for every patient. This one is geriatric patient in the post-acute rehab facility. So it means that it is applicable in any settings. Okay, now this is activity. Form a group consisting of 3 to 5 members. You will be given a case study, and based on that, you are required to illustrate a complete ICF model to guide your assessment and treatment. Okay, so we'll discuss this. Okay, so that's it. That's it for this topic. Okay, so by now you are able to discuss and analyze the model of service delivery for older people. Okay, so now what you need to do is, all right, focus. Okay, uh you remember that you have seen patients, okay, elderly or older patients maybe, okay, and you try to map whatever presentations that they presented or that you found, okay, from your assessment, map it in the ICF model, okay, and try to relate with the activity limitations and participation restriction, okay. And also you may want to address some of the barriers of facilitators based on their environmental factors and personal factors, okay. So because basically physiotherapists will look at the level of impairment, okay. Sometimes we miss the activity of the patients, whether they are able to go back to their normal activities, whether they are independent in their ADL. Okay, it is very important because they need to continue living, you know, especially those who are living alone or who has no reliable caregivers, okay. They have to do many of their ADL on their own, okay. So we have to ensure that they have a certain level of ability, or maybe we need to modify certain activities or certain abilities, you know. We need to think how to modify so that they can still perform an optimal level of activities of daily living, okay. So when we are meeting in the class, we hope that we will have time to look at some case study and map it on the ICF model, okay. So thank you very much till then, okay. So we'll see you soon.